Hey there everyone, did you know that necrosis has devastating effects on the body and often is a sign of serious underlying issue? Yes, it is a big deal. So, in this video, we will dive into this topic deeply. What is necrosis? Necrosis is a type of irreversible injury. What is irreversible injury? The injuries which cannot be reversed or which cannot be healed are known as irreversible injuries. It occurs due to the severe or persistent ischemia, which leads to severe and persistent hypoxia. Then it leads to the stoppage of sodium potassium ATPase pump. In reversible injuries, the sodium potassium pump activity decreases, but in irreversible injury, the activity of sodium potassium ATPase pump completely stops, which leads to increase in sodium and starting of reversible injury. But also it leads to the increase in intracellular calcium, as we can see in the diagram. So due to increase in intracellular calcium, it activates enzyme. As calcium is cofactor of many enzymes, it activates mainly APE enzymes. APE is a mnemonic for learning the names of enzyme: ATPase, protease, phospholipase, and endonuclease. So what does ATPase does? ATPase breaks ATP. Due to the breakage of ATP, there is depletion in the ATPs and leads to aggregative necrosis. Now, protease and phospholipase, both of them damages plasma membrane and lysosome also. So, due to which there is release of hydrolytic enzymes. Due to the release of hydrolytic enzymes, there is damage in surrounding tissue. To recover the damage, the neutrophils come to that area and engulf the damage. Therefore, it is known as neutrophil infiltration or acute inflammation. Diagrammatic representation. This one is a normal cell. After the injury occurs, plasma membrane damages, also the lysosome damages. Due to the lysosome damage, hydrolytic enzymes comes out and damages the surrounding area. The surrounding area gets damaged, neutrophils comes to engulf this area, therefore it is called neutrophil infiltration or acute inflammation. Now, endonuclease. Endonuclease three works. It has three works: chromatin condensation known as pycnosis, chromatin fragmentation known as karyorrhexis, and dissolution known as karyolysis. Now the changes: electron microscopic change. In electron microscopic change, two things occur. As there is increase in calcium in the cell, it deposits as large, flocculent and amorphous density in the cell, and due to phospholipase action, there is a breakdown of phospholipid, and then it forms myelin sheet as seen in the diagram. The broken down phospholipids are in bilayer. These were the electron microscopic change. Now the light microscopic change. Light microscopic change also occurs due to two things, mainly protease and due to karyolysis. Protease damages proteins. Therefore, there is increase in eosinophilia and it stains more pink. And karyolysis is chromatin lysis, which decreases basophilia and therefore decrease blue stain. These were the light microscopic changes. Now, types of necrosis. This is the normal cell and these are the types: coagulative necrosis and liquefactive necrosis, in which coagulative necrosis is major type of the necrosis. What is coagulative necrosis? In coagulative necrosis, cell outline is damaged but yet preserved, as we can see in the diagram. It is damaged but the cell membrane is also preserved. The reasons of preservation of the cell membrane are decreased pH. Decreased pH inactivates enzyme, therefore cell outline is preserved. Second, protein. Proteins coagulate, therefore cell outline is preserved. And third, collagen framework. Collagen framework maintains outline. In liquefactive necrosis, cell outline is damaged and not preserved, as we can see in the diagram. Now the examples of coagulative necrosis and liquefactive necrosis are, let's start with the coagulative necrosis first. Examples are ischemia to all solid organs, but there is one exception: CNS. Second, thermal injuries. And third, Zenker's degeneration. Zenker's degeneration is necrosis in rectus abdominis muscle in typhoid fever. And examples of liquefactive necrosis are ischemia in CNS, as it is an exception of coagulative necrosis with bacterial infection. Liquefactive necrosis is also known as colliquative necrosis, and coagulative necrosis has three terms which are tombstone appearance, glossy appearance, and moth-eaten appearance. These were the main types of the necrosis. There are also other types of necrosis which are gangrene. What is gangrene? Gangrene is a clinical term. There are two types of gangrene, dry gangrene and wet gangrene. As dry gangrene suggests coagulative necrosis, and wet, as the name suggests, there is liquefactive necrosis. In coagulative necrosis, ischemia occurs to region and it undergoes anaerobic decomposition, due to which the tissue becomes black and offensive. In wet or liquefactive necrosis, there is dry gangrene plus there is bacterial infection that will release proteolytic enzymes, and therefore the membrane is destroyed and leads to liquefactive necrosis. Fourth type of necrosis is a caseous necrosis. Caseous necrosis is seen in infections by mycobacteria, tuberculosis, MTB, syphilis, and histoplasma. It is extensive ischemic tissue damage, and therefore it appears as white, cheesy deposition. This is called as caseous necrosis. In microscopic examination, granuloma is seen in caseous necrosis. Fifth type of necrosis is fatty-necrosis. Fatty necrosis occurs due to damage in the adipocytes. Damage can occur by two methods: trauma or enzymes. Due to damage, the triglycerides become free fatty acid and then can combine with calcium, and therefore chalky white deposition occurs. This process is known as saponification. Etiology: trauma to fatty tissues, example breast, buttocks, and abdomen, as their fat is stored, and enzyme lipase from acute pancreatitis. This was the fatty necrosis. Sixth number is fibrinoid necrosis. It is actually not a necrosis, but homogeneous pink stains get surrounded. It is by fibrin, antibodies, and other proteins. Fibrinoid necrosis occurs in the damaged blood vessels. It can be seen in the malignant hypertension and vasculitis and immune complex deposition. So this was all about the necrosis and its types. I hope you understood what I teach, and please subscribe to my channel, and if you have any suggestions, please comment down. Thank you.